Hi, so today we are looking at Tunia massage. And I have the lovely Dr. Song with me today, and he's going to be my masseuse and also going to tell us about what this massage style is. So, hello, Dr. Song.
Hi.
Thank you so much for being a part of this.
Oh, thank you so much for having me here.
You're welcome. So, tell us what the theory of Tuina massage is. Is it like the oldest style of Chinese?
Yes,
massage?
actually, since it started, actually in Chinese medicine, the basic characteristics is holism. How
yes.
can we connect different parts of our body together?
Yeah.
How do we connect the mind and the body together? How do we connect the different parts of our organ together? That is meridian. We need to make the qi flow well in the meridian.
And the qi is that life force energy. Is that what you mean by qi?
You can say that it's not all of it, but if we go to detail, that's too complicated. Maybe we can speak that for 2 days. But basically, it's like this. For example, most uncomfortable, most symptoms, what we feel is some disorder of the qi. I think like what I told you before, like people feel the pain. Is some blockage there. Yeah. People lost their loved one, they feel here.
Yeah, heartbreak.
Like a heartbreak. Yeah. Like people anger, like qi goes up.
Into like the head.
Like that. And like people block.
Is that worry? Like
worry
anxious?
also kind of it.
Yeah.
Pain, worry, a lot of it have some relation with the qi. Most of them are blockage.
Yeah.
So this blockage is so important. Oh, maybe this case this example is not that nice, but think, what is the most not happy, most comfortable time is you're definitely looking for a toilet.
Yes.
Finally, you find it.
When you're like busting for the toilet.
Yes, actually, in our life, every day like this, because the mind always can come to our body, because you think, oh, tonight after this, I have to go to supermarket. Something here. Before this problem solved, this thing will stay there. And this stress will come to your body. This, everybody all the time have some blockage. Yeah. All the time have some uncomfortable. So that's why we say only Buddha. Yeah, that is really health, no blockage, man. Even you come to me, I can tell you smell like this, but that is different from this, right? Because some stress, some conflict, some task unsolved come to different of your body. If you only go to face, doesn't matter. If it goes to your body, you will feel pain, maybe headache, tense of neck. Go to the stomach, you feel tight. Yeah, even cause your indigestion. All of this. That what main purpose, one of the main purpose is to relieve the blockage. Yeah, that is one thing, more for the internal situation. We also have some external situation, more particularly work on exactly damage the tissue. For example,
what's the tissue?
Tissue like a muscle.
When people come in for Tuina,
first
of all, the first thing you mentioned there is that they're feeling blockages, so their emotions are like a part of that, so they feel stressed or angry, and that messes with the qi, and that's a blockage. And now the next step you're saying is if they already have some tissue damage already in their muscles, which probably stemmed from that emotional core anyway.
Yes.
So but then that's the second part. Okay.
During the consultation, the most important thing is to diagnose. So we need evaluate, assess how much the brain, mind contribute to this problem, how much the tissue damage contribute to this problem. Right. Then we find what exactly is. For example, the more for the local tissue damage, maybe we work on locally because that is easier.
Yeah.
But if they also have mind thing, they also have some tense mind here. We also need to stimulate a certain point to relieve the tense of the mind. So some people ask me when I do acupuncture or massage, they said, oh, I got pain on the back. Why do you put needles on front?
Exactly what happened to me at acupuncture. I thought the needles were going to be at the back, but they were at my front as well.
Yes, that's it. Because there are many ways related to it. strange. Well, I got headache. Why do you put the needles on my foot? So. Yeah.
Exactly right, but that's true. We've heard about that from Dr. Key as well, about the different mapping of like your bodies on your face, on your hands, on your feet, on your tongue. It's everywhere.
Yeah, sometimes even people, one of my patients come to his doctor. He said, "Oh, my headache is because my shoulder here pain causes my headache." Then the doctor sent her to do the MRI, CT scan of the head. Nothing wrong. She said, "There's nothing wrong. Go back, take painkiller." But we treat here, feel better. Oh, okay. You know, that is some reaction point. Yeah. So we can't just treat sometimes it's difficult to treat exactly the problem. For example, the tense in the mind.
Yeah, that is
the tense in the inside the organs.
Or if it's a broken heart, you
broken
you can't,
heart.
Get into the heart. You have to
of
go
course, if
somewhere
we
else.
can put the hand in, that will be better, right? But
I would love to just hold your heart like
but
that.
if I don't know you have this kind of experience or not, even anger, if you can do this, I feel such a relief. That's why people go to drugs, go to the alcohol.
Because
to do
that pain.
Yeah, because numb. But we can't put hand in, we can't put needles in. No. But what we can do is this connection. We put the needle here, do massage here, affect the central nerve system to relieve it.
Right.
That's in Chinese medicine, we say that is meridian. Sometimes, sometimes it works dramatically well. Even I don't know why. So, but it can happen.
So we've got this guy here. You're talking about meridians.
Yes.
So are these the lines that you mean by meridians?
Yeah, let me talk about this.
Yeah.
Sometimes people have misunderstand of meridian.
Oh, yes, do tell us.
Firstly, they think meridian is just this.
That is what I think.
This, we only can say this is the main road of qi flow.
The main flow, did you say?
Yeah.
The main flow of
qi
flow. Okay.
And they also have branches, like our blood, like our road on the city. So they have main ones, they have
roads and ones. And like veins as well, like those.
Yes. And another thing is different people, they may be slightly different. Okay. For example, some people their sciatic nerve are slightly different to others. So if some people focus on what exactly that point is, that's not necessary. Oh, right. We need to know generally it's here, but we need to find we call it like sensation.
Right.
Yeah, this area we got this sensation, that is the point. Okay. Not from here, or 3 tone below, 2 tone above, or something like that.
So it does change, it differs person to person.
Slightly
change. The basic
format.
Okay.
From that, apart from that, there are also some particularly like a single point, react point, not on the meridian. Okay. We call it arch point. What is arch point? R means ouch. Arch point, like ouch. Ouch point. Sure. But many people have this. For example, some people feel tight chest. We can find some point on the back. That area very tight. Wow. We relieve that, they feel, I can't breathe. And sometimes
like a puzzle piece. That's so cool.
Yeah. Sometimes the people have like gluteus muscle. So one lady told me, for 4 years I don't deep breathe. I think that should be my life like that. But when you relieve that point, I can deeply breathe. So that's because this react point, sometimes like that. So
for me, I'm going to say, what I'm going to tell you when I get the massage with you is that here, so on my left side, I get like a really bad pain, like kind of like from my lower back around here. And it goes all the way down my leg.
Yes.
And I think it's when I don't do enough exercise, when I just sit at my computer all day for like a week because I have too much work to do. So that.
Yes.
But I also notice if I wear really, really, really tight jeans around my waist, I notice it comes as well. So that is what I'm going to be telling you about. So what might you do to me? What do you think you might do?
It's like this. Firstly, we will do the general assessment.
Okay.
Obviously, you don't have many emotion things. You have a lot of stress or not.
Sometimes I feel like I do have like an underlying stress,
Yeah, but that is one thing I need to know, because that will make the pain. This is not the real cause of the pain, but definitely can make this pain worse and last longer, can make this muscle tense more.
Yes.
That is one thing. That can through many ways. For example, like Tai Chi, qigong or
So I should
relief.
do that to help relieve
Yeah,
that.
but that
Okay.
is, and another thing, I might try to look for some point. If you have
Right.
stress,
Yeah.
like this area, maybe have some point very
Right.
tense.
Okay,
Another
right.
thing is we have to precisely, very accurately relieve all the pain muscle, pain tissue.
Right.
That is important because Tunia, if you just do that, that is not Tunia. Tunia have to be very accurate.
Yes.
So you have to work on it. Otherwise, it's difficult to treat.
Yeah.
Thirdly, you might have some tissue like spasm or shorten. Yeah, that we need to use something way to stretch. This stretch also have a different way to stretch. If we stretch, we have to particularly stretch that muscle.
Right.
Because sometimes you you look at internet, oh, I have this pain, I can stretch this way.
Yeah.
That might not work because you have to stretch, particularly there. Even a little bit higher, even a little bit lower, maybe not work.
Right.
And
So
another way,
exactly to that point.
yes.
Exactly, yeah.
And another way is how to stretch it well. You can stretch it directly, for example, like this, like that. But that one thing is maybe not that accurate. Another thing may be overstretched. Sometimes we use like a cycle way. Can you understand this?
Like
When
a
you
wave with your muscles.
not
in
not
their
way,
muscles.
like you do the
Or you like-
circle.
Oh, okay, so
this
like
way.
twist the
Yeah,
muscle.
that
Okay,
that
sure.
that will stretch not only one muscle. These
the
all
surrounding
these
ones,
around
yeah.
make it more harmony. That is the
harmony
better way.
for all of
We,
them,
we, we
okay.
need to find the way
Yeah.
of the combination of all of this to give treatment. After
right.
that, maybe we also need to suggest some good exercise.
Yes.
Exercise
Yes, that
also
would be good.
very
Exercise that,
important. You
yes.
know, for example, if people have more mind issue, we need some aerobic exercise
Yes.
together with some like qigong, tai chi, or whatever. Yeah. For the local area, we know like muscle build, big muscle stronger, or stretch, particularly that muscle.
Okay.
That is the
So maybe like
basic.
Pilates or yoga or stretching or something like
Yes,
that. Describe.
yeah, but but
don't
no,
know.
we don't say what exactly is now, but I will tell you which move you do, and when you do
Okay.
that move, you have to feel what. For example, I will ask you,
Okay.
do you feel you stretch particularly that muscle? You
Right.
said, oh, that is right. So you have to
Okay.
do that.
And
For
so you
example,
actually
even
feel it.
this a little bit up, a little bit down, maybe you can't get the result.
Yeah. Right. And the last thing I forgot to say
Yes.
is in my right knee here. When I walk all day or when I go up hills, like when I go hiking, it really hurts inside my knee, like inside
Yes.
there.
So that's
But I don't feel that unless I've been walking all day. So
Yeah.
there's no pain right now, but
so
it comes.
I think we can find it. So when you go upstairs or when you go downstairs, you
Definitely,
have
it hurts faster when I'm doing that. But even after like walking for like 6 hours, it just hurts even if I'm flat.
So because that also have many possible reasons.
Yeah.
The most difficult one is related to age, like osteoarthritis. Maybe you are far from that age.
I freaking hope so.
Yeah. So another thing is sometimes it's inside the fat pad. You know, in fat pad, like some pad reduced. When you pinch can cause the pain. Sometimes it's the tendon around it. That is because you do too much running, too much exercise, sometimes because of that. The treatment are also different. Firstly, we try to relieve the blood circulation there. Maybe we need stretch, but maybe I think not. Another thing is exercise is important. You need take certain weight, but not over it.
Okay.
Yeah, that is important.
So like gentle walking or something.
No, not like that. You have to particularly do something
Okay.
you need to take that. Oh,
Okay.
do I explain a little bit more?
Okay. Yeah. Sure.
For example, this is a tendon. Tendon is different from any other tissues. For example, muscle, we just do hard, whatever we do, it's fine. It will can be because muscle have very good blood supply.
Right.
Yeah, but the tendon have very limited blood supply.
Okay.
That means its recovery ability is very small, very limited.
Okay.
So when we do that, we use a certain amount of stimulation. We also don't put needles exactly in that tendon because even this small damage maybe make it difficult to recover. Right. So what we do is we relieve the pain there and do some exercise. Exercise is like this. Tendon like this. If you overdo it, it might boom.
Okay.
This will cause problem. But if you don't do it, without this stimulation, it can't grow, can't recover.
Okay,
We
so
need to
do
find
this, okay.
exactly you should. Later I will explain that.
Yeah,
but firstly, we need to diagnose it well. That is the base of the treatment.
Right. What are like the basic techniques that you use in a massage? So is it like, do you use your own body? Do you use like scraping? Do you like, how would you say? Just a few,
like this. Actually, normally we don't separate all the technique like this, that. But generally we can, like we do Tai Chi, we use every part we can use. There's two purposes. One purpose is we can work accurately on the patient. Another purpose is we have to protect ourselves. For example, thumb is the best to treat. But if you always use thumb and finger, you can't treat so many patients.
Yes.
So normally, for me, I use most is elbow.
Yeah.
But that doesn't mean elbow is better. That doesn't mean if we don't, the problem don't require very accurate, and I know exactly what is it, I can use the elbow.
Yeah.
Sometimes some people also use the knee, foot, or whatever. But I don't use that. But some open. People, that no, I don't, because safety also very important. Yes. That's all these things we need to put together. For me personally, I use like elbow, hand, thumb, finger. For example, we can use hand, do this. We can use thumb, do this. We can use elbow, do this.
Okay,
we can use pushing, kneading, and manipulation. All these kind of things. Rubbing, rubbing, also cool. Rubbing, rubbing, nice. Like that. So that's a lot of these things. Yeah.
Okay, great. Well, thank you. So we'll get into it now.
No problem.
The song, and so now we're going to get into the actual Tunia massage.
Oh, great.